Okay. Good afternoon, everyone, and welcome to another social emotional workshop. Today we are with Lisa Kaplan from Henry Ford Health Systems, and today we are going to be talking about alcohol. Lisa, welcome back. We're so glad to have you.
Okay, thank you. I'm happy to be here. So, as you may know, when a person is addicted to alcohol, they have a disease called alcoholism. The formal term, the medical diagnosis is alcohol use disorder. It falls under the umbrella category of substance use disorder. So people who have this disease are considered to be alcoholics. They get a bad rap. People use some pretty negative language to describe them, such as calling them drunks. And that's really disrespectful for someone who has a disease. So we want to remember that calling someone a name like that, you would never say that about someone who had diabetes or heart disease. You wouldn't come up with a negative connotation. So we want to be really respectful of people who are struggling with this disease. So there's 11 different criteria for any substance use disorder, including alcohol use disorder. So if you're interested, you can look it up in the DSM-5, the Diagnostic and Statistical Manual 5. So I will say that COVID didn't do anybody any favors when it comes to having alcohol problems. In the first couple of months of the pandemic, alcohol sales went up over 40%. I can tell you that the patients I work with, almost all of them will tell you that COVID created worse feelings of isolation and loneliness and increased their alcohol use. So it certainly did a number on people. So alcoholism can develop very, very slowly in some people and quickly in other people. So the younger a person is when they start using, the more likely they are to become addicted quicker. So a teen that you may be working with who's starting to drink will become alcoholic long before an older person. So some people will drink socially for 30 years, never have a problem. But that 31st year is when that disease kicks in. Okay, so it could happen to anyone at any time during the lifespan. And there's a huge cost to our society with alcohol. As you probably know, health problems, public safety in terms of accidents, drunk driving, things like that, time lost at work, and huge impact on the family as well, broken promises. So when people are in a blackout, they function normally, but they do not remember what occurred. So a parent could tell a child, I'm going to take you to the movies on Saturday, and then Saturday rolls around and the person with the alcohol use disorder says, I never said that. He's not lying. He does not remember because a big chunk of time is missing, and we call that a blackout. And of course, people do things under the influence that they might not normally do, and that includes violence. So children could be living in a home where one of the parents gets intoxicated and becomes violent, where they might not be otherwise. So alcohol is the #1 drug problem in our society today. I will tell you that most of our patients in our inpatient substance abuse treatment facility, most of our patients are there for alcohol. Some of them are there for other reasons as well, but most are alcohol. It's the #1 reason why people seek treatment. And as you know, it's legal over the age of 21 and very prevalent in our society. You really can't go anywhere without finding alcohol. A gas station, a nice restaurant, a sporting event, alcohol is everywhere. And many people will be social drinkers for the rest of their lives and never develop the disease of alcoholism. So one thing we impart on our adolescents is that a standard size drink, all of them have the same amount of alcohol in them. So a 12-ounce beer, a 5-ounce glass of wine, and a 2-ounce shot glass of liquor all have the same amount of alcohol. So what we teach our teens is that even though it's a very small glass with only a little bit in it, the content of the alcohol in that small glass is equal to a 5-ounce glass of wine or a 12-ounce beer. So kids need to know when their friends say, oh, it's just a little bit, it won't hurt you. It is the same as any other standard drink. So you might have heard the term binge drinking. This is a pattern of drinking that brings a person's blood alcohol content to 0.08 or more. As you may know, 0.08 is the legal limit for drunk driving. So for men, that typically means 5 drinks in a short period of time, and for women, 4 drinks. And it's really within a 2-hour period. And I don't like telling people that, because a man who hears that, who doesn't have 5 but has 4, thinks that's safer. And it's really not much safer. So there are people who can be binge drinkers who do not have an alcohol use disorder. However, it's very common. So what happens with people who are binge drinkers, or even if they're not binge drinkers, people can develop what we call alcohol poisoning. It's when the amount of alcohol in their body is too overwhelming to be processed and eliminated effectively. So people can pass out from alcohol poisoning. What we tell our kids is, our teens, is that there is a Good Samaritan Law in Michigan, which means that if you are with a friend who had too much to drink or too many drugs in their system, rather than leaving them to sleep it off, which could be deadly, if you get them to an emergency room or to a police department, you, as the Good Samaritan, will not be in trouble. And what they found is that kids were dumping their friends off places so that they wouldn't be caught with them when they got in trouble for using, and then kids were dying. So any emergency room will accept a person who is being dropped off by their friends, no questions asked, no police involvement. So we call that the Good Samaritan Law. So some of you may know that there are medications that are used to help people who have alcoholism to stay in recovery. And Antabuse is a very, very old medication. If a person takes Antabuse and they drink, they will become violently ill. And they know this in advance, so it makes them not want to drink. So Antabuse is a very old medicine that is still prescribed, and it's very effective. The problem with Antabuse is that if someone decides to be non-compliant, meaning they want to stop taking it, they can. And a couple weeks later, they can drink without any effects because the medication will be out of their body. The other problem with Antabuse is there are some mouthwash and hand sanitizers and salad dressings that contain alcohol. So if a person has a salad with salad dressing while they're on Antabuse, they could become violently ill. So they have to be very careful about what they are eating and using on their body. There's other newer medications though. Naltrexone is an oral medication that's also an injection once every 28 days. It's called Vivitrol. And a person who takes that medication, they will not be able to feel the effects of the alcohol, and it helps to curb cravings. So that's a really effective newer medication. There's another one called Kaplan, which is an oral medication taken 3 times a day. So thankfully, we now have additional tools to help people stay in recovery from alcoholism so they can continue to be parents and go to work and be functioning members of society. So let's talk now about some health issues related to alcohol use. Short-term effects include, and I have a whole laundry list here, slurred speech, drowsiness, vomiting, diarrhea and stomach upset, headaches, breathing difficulties, distorted vision and hearing, impaired judgment, decreased perception and coordination, unconsciousness, anemia, coma, blackouts, and death. Pretty severe. So now let's talk about the long-term effects. Unintentional injuries such as car crashes, falls, burns, drowning, unintentional injuries, firearms, sexual assault, domestic violence, increase on the job injuries and loss of productivity, increased family problems, broken relationships, high blood pressure, stroke, and other health-related issues, liver disease, nerve damage, sexual problems, permanent damage to the brain, vitamin B1 deficiency, ulcers, gastritis, malnutrition, cancer of the mouth and throat, and death. So as you can see, there's a huge, huge toll on the body when people are using alcohol. So I will say this, if you know anyone in your life who has an alcohol problem and decides to quit on their own, it is not safe for them to detox themselves at home. Okay, we worry about high blood pressure and seizures. They need to get to an emergency department or a rehabilitation program that has medically supervised detox. And you may know people in your life who say, I've detoxed myself many times at home, never had a problem. Okay, they've been lucky. They might not be so lucky the very next time. So please impart that knowledge to people because we want to save lives. And with that, I'll open it up to any questions or comments about alcohol.
You guys have any questions, comments that you would like to contribute? You can either type it in the chat or I can unmute you and you can ask your question or make your comment.
I'm wondering if you're seeing kids using alcohol because of the loneliness and isolation by being homeschooled. You know, if parents have it in the house, I'm just wondering.
Oh, okay, there's a comment in the chat that says, it's really interesting about not detoxing alone. And another comment is saying, I didn't know it was so dangerous. Neither did I. Also, I was going to say that by it being a virtual program for us, being able to determine or detect signs of students using is really hard, you know, and more likely than not, we're not really able to do so. You know, we can't tell. You know, the only way that we can gauge that something is wrong, not identifying specifically what it is in their work. When they're not doing what they need to do, or they're having difficulty with it, we can tell that there is something wrong, but we can't identify it specifically as it being alcohol or even drug related because it's virtual, you know.
Do they ever confide in you about this problem in their family?
Sure. Oh yeah, they open up and they share a lot of things about what's going on in their home lives, which is why we have these workshops, because especially since COVID, you know, they are just so exposed and saturated and dealing with things that they never had to deal with, you know. And so, yeah, they
are we, as are all of us.
Mm-hmm.
Yeah.
They definitely open up and say, you know, this and the other is going on, and can you help? And it's just been really, gosh, it almost puts you at a loss for words, because you're not just dealing with the student, you're dealing with the student and their family and their parent and their siblings, you know, because by us going through this pandemic, even if the parent never says anything directly to the child, they hear what's going on in their household.
Right.
And it affects them, you know.
Right. It does. So let me tell you something that could help a teenage, even younger than teenage, if you've got a student And there's a support group called Alateen. So you've heard of Alcoholics Anonymous and Narcotics Anonymous, which is for the person who's using. And Al-Anon and Nar-Anon is for the adult family member. But Alateen is for teenagers, and they'll take them even younger, like 10, 11, 12, who have a loved one who's using alcohol. So they're 12-step support groups. They are online. They are also in person, depending on where you live, what part of the state. So it's something to think about as a resource for your teens.
Good deal. Good deal. Anybody, questions, comments before we bring this to a close? Yeah, comment, thank you. Always learn something. And it's true. These are areas, these are social emotional issues that cannot be oversaturated. You can't speak enough about these because it is information that A, is much needed, but two, it's evolving. It's always changing. The game is always changing. The game never stays the same. And so in order for us to stay on top of what's going on and be aware so that we can effectively assist our students, these kinds of workshops have to be ongoing and continual because, you know, it's so much happening. Every day it's something different, every day is something new, just like the shooting in Oxford. You hear it's coming out that the student, he was reaching out, but he didn't have a support system, to help him and to recognize and to know what to do,
Yeah.
there's just a lot of not knowing what to do, and that's why a lot of things happen and go untreated and unchecked and unnoticed because you just don't know what to do. And that's why these are so important. These are so incredibly important for us to stay connected so that we can spot something and say, oh, wait a minute, you know what, that's not right, something's off here. All right, well, again, thank you, Lisa. Great
You're welcome.
presentation. And we will see you next time. And
Okay.
everybody have a great day.
Thank you. Bye, everyone.
Bye. Bye, you guys.